On November 6, 2013, a silky terrier was brought in because it was vomiting for 19 days. These are the x-rays of the patient taken by another vet. What is wrong with these x-rays? This is a Be Kind to Pets veterinary educational video sponsored by Payoh Vets. This Be Kind to Pets veterinary educational video shows surgical procedures. Viewer discretion is advised. The patient had consulted two other vets, Vet 1 on day 1 of vomiting and Vet 2 on day 3. According to the owner, the patient swallowed numerous chicken ribs. Hence, Vet 2 took x-rays to check if the patient had ingested any chicken bones. From these x-rays, Vet 2 concluded there were no chicken bones, but the patient continued to vomit for another 16 days. This is the problem with cloudy x-rays. As you can see, the x-rays are very murky and unclear, so the chicken bones cannot be seen clearly. Hence, cloudy x-rays can lead to misdiagnosis. At Payoh Vets, the vet insisted to repeat the x-ray for confirmation. Comparing the x-rays, you can see that the second x-ray is much clearer and the patient's organs can be seen more clearly. Furthermore, we can actually spot the chicken bone in the cauda esophagus near the stomach. So the daily vomiting was indeed caused by a chicken bone. This is a summary of the patient's history. On 18 October, the patient swallowed chicken ribs and started vomiting. On day 1, it consulted Vet 1, but the vomiting continued. On day 3, 21st October, the owner consulted Vet 2 and he took an x-ray. Vet 2 stated there were no bones, but the patient continued to vomit. On day 10, 28 October, Vet 2 did ultrasounds and he still stated that there were no bones. The vomiting continued and the patient was lethargic. On day 15, 2nd November, the owner consulted Payoh Vets, but the owner did not want an x-ray done as he insisted that the x-rays by Vet 2 were conclusive. Finally, on day 19, 6 November, the owner reluctantly agreed to do a second x-ray and a chicken bone was spotted in the patient. What are the impacts of cloudy x-rays in veterinary practices? Firstly, the misdiagnosis can result in poorer health in the patient. Vomiting for 19 days could have killed the dog due to malnutrition, dehydration, and esophageal ulceration and infections. Secondly, this may also result in a higher cost for the owner, as the owner has to visit the vet multiple times and pay for further x-rays. Thirdly, there may be legal implications. The owner may sue the vet or complain to veterinary authorities for negligence. Litigation for negligence is very costly and time-consuming for the vet. In this case, the owner demanded compensation from Vet 2. Hence, vets need to be careful and prevent such cloudy x-rays. What are the solutions to correct cloudy x-rays? Firstly, the x-ray settings should be checked before the x-ray is taken. Cloudy x-rays are usually caused by incorrect exposure settings like underexposure. The exposure is mainly affected by two factors, the KVP and the MAS. Firstly, KVP refers to peak kilovoltage, and it controls the contrast of the X-ray film. A lower KVP value leads to a higher contrast, and hence the X-ray will be cloudier. A higher KVP value leads to a lower contrast, and hence a less cloudy X-ray. Secondly, MAS refers to milliamperes times exposure time, and it controls the density or blackening of the X-ray film. A lower MAS will lead to a lighter X-ray film, causing cloudiness. A higher MAS value will lead to a darker X-ray, reducing the cloudiness. So how can the optimum exposure settings be achieved? The vet can refer to an X-ray exposure chart, which lists the optimum KVP and MAS levels for various types of X-rays. Secondly, if the X-ray has already been taken, image editing can be done using various softwares such as Photoshop. The contrast of the X-ray film can be increased to reduce the cloudiness and make the X-ray film clearer. Comparing the original X-ray from Vet2 and the edited version using Photoshop, a chicken bone can actually be seen in the patient in the edited film. In conclusion, the Silky Terrier underwent a surgery to remove the chicken bone at Payoh Vets, and it recovered fully after 10 days. In this video, the dangers of cloudy X-rays are highlighted, and these are the advices to vets. Firstly, vets should monitor the X-ray settings before taking the X-ray to make sure that the conditions are optimal. Secondly, if the vet's staff are taking the X-ray, the vet should provide regular training for his staff to ensure that they are able to take a proper X-ray film. Vets have to be very careful when taking X-rays, as cloudy X-rays can lead to misdiagnosis. This Be Kind to Pets veterinary educational video was done by intern Chung Jia-en with the help of veterinary nurses Su Monlun and Reina Mutia Cardinio, as well as veterinary surgeons Dr. Sing Kong Yuan and Dr. Daniel Singh. For more information, please contact +65 6254 3326 or +65 9668 6468 or 99pups@gmail.com or visit topayohvets.com. For more Be Kind to Pets veterinary educational videos, please visit topayohvets.com/videos.htm.